Hello, I'm Paramedic Student Weary. Today's video is scene survey and primary survey. First off, BSI, I have my gloves and my safety glasses on. Then I'm going to make sure the scene is safe from hazards such as electrical, chemicals, thermal, and or weapons. Then I'm going to check my environment, temperature for hostiles and bystanders, and if it's day or night, and if I have adequate space to work on the patient. And then I'm going to check the mechanism of injury or illness, number of patients, additional resources if needed, and consider C-spine stabilization. Then we're going to move into our primary survey. For appearance, we're going to use the FEDSO. Facial expression, eye contact, dress, speaks when approached, and odors. And then for worker breathing, we are going to use WARF, words per sentence, abnormal sounds or positions, R, retractions, and F is nasal flaring. And for circulations, we're going to use the patriotic, red, white, and blue. Red for fever, CO2, sunburns, allergies, white for shock and anemia, blue for cyanosis, etc. Then we're going to move to determine the patient's level of consciousness. We're going to use the AVPU. Alert, verbal, pain or painful stimuli, or unresponsive. And then we're going to move into the chief complaint or apparent life threats. Listen, look for equal chest rise, sucking chest wounds, fixing anything that needs fixed that are immediate life threats, bleeding, so on and so forth. Who called EMS? Why did you call EMS? And then we're going to move into access to airway and breathing. Does the patient's breath equal and bilateral chest rise? Is there air moving? Yeah, I'm going to secure my airway if I have to. And then we're going to move to circulation. I'm going to place my forearm on the forehead. I'm going to check the patient's pulses at the wrist. I check for trigger and texture of the skin and temperature. And then we're going to move to the eyes. We're going to check the eyes. And then we're going to move into exposing the chest. Check for JVD, lung sounds, PMS, and identify if the priority to transport the patient. Excuse me. Thank you.